I am running out of time, too much to say. The one lovely thing, I didn't say using examples, from inner Sydney there was a report that I can give you the title of, and it talked about gardens as good medicine. And there is evidence for the population health benefits of each of these dot points. Each of these dot points is related to a good health outcome, and they are all benefits that people derive from gardening. I was going to say stuff about local food environments and conviviality, but I might do that in any questions.
Do you want to just go back to your governance thing, because I know there's lots of people who are interested in that. Yeah.
We did this, okay, how do you join up mobility systems and food systems, along with all the other interventions that governments make? We did a small exercise in the Australian Capital Territory, which Canberra sits at the heart. We did an audit of some of their more progressive policies, and this is something I'd like to... So this was in the context of healthy weight. So we looked at their social plan, their spatial plan, their children's plan, and we did find present in all plans a focus on physical activity, cultural planning, transport planning, neighbourhood planning, social connection. But we didn't find present in any of them, funnily enough, references to connections to nature, appropriate diets, even in the children's plan, or retail planning. And at the same time that we were auditing these plans for a connection between physical activity and diet, the government was doing other things to override any of the health benefits of these plans, through closing schools, so children could no longer walk to school, and they were closing parks, so diminishing family opportunities and young people's opportunities to hang out in parks. So I was just going to say, in terms of governance and talking about co-benefits, unless you can align policies and make them work synergistically and really attend to things in your land use that look at retail planning and how people get appropriate diets, then you're not doing enough. But we do think that there is, in terms of governmentality again, there is a greater sophistication, and there might be examples that I don't know about from New Zealand, although just recently I've become aware of the HEPRU's Enhance project here, where physical activity and food and diet are being lined up together. But we are aware that there are examples where people are trying to re-embed diets and physical activity through government regulation and policy, and acknowledging the social and physical landscape. The South Korean government has announced that a body and a land are not two different things in shaping its healthy weight initiatives. So the Australian National Heart Foundation, the Toronto Food Policy Council, the London Mayor's Food Strategy, and the California Centre for Public Health Advocacy all have something to say about healthy by design. And I think on that note I will stop and turn it over to discussion. There are references.
Well, thank you very much for such a
thoughtful, cogent, and interestingly, theoretically informed address. I think that's really, really significant, important event. And for the Centre for Sustainable Cities, particularly interesting because a couple of weeks ago we had a really interesting presentation based on Māori view of the power and the city with architects John Gray and other people speaking about how we could think again about the traditional ways of using city land in New Zealand and based on power and kaianga. So we're doing quite a bit of thinking about this, and I know there's people, lots of questions. If people could, please, we're recording this to put on our website, so it would be helpful if you could speak. I might take this around. Is this going?
I don't know.
Okay. I might take this around so everybody can hear, and if you could just say where you work or what your interest is when you talk, please. I should say Celia Wade-Brown, who couldn't be here from the City Council, said that the City Council's really interested in this, and what's the name of it?
Eleanor Doig.
Eleanor Doig. Oh, you're here. Oh, well, if you would like to speak to Eleanor Doig afterwards. All right, so I've got the mic, which is working. Any questions, comments?
Hi, I'm David Young. Thank you very much for that wonderful talk. I'm interested in health and the environment, and I'm going to be coordinating a course in public health